Okay, so the next speaker is Dr. Priyadarshini. Correct. Are you here? Yeah. Comparison of retinal microcirculation using OCTA in anisometropic amblyopia and anisometropia. You have 5 minutes.
Good afternoon, everyone. I'm presenting comparison of retinal microcirculation alterations using Octa in anisometropic amblyopia and anisometropia. We know amblyopia is unilateral or bilateral reduction in best corrected visual acuity during the years of visual development, which is secondary to abnormal visual stimulation, and it's the most common cause of monocular visual loss in children. Anisometropic amblyopia, it results from the blurred visual input that is caused by hyperopia, astigmatism or myopia with a difference of one diopter between the eyes. And we know Octa, it is non-invasive modality that permits the visualization of microvasculature. Our primary aim was to compare the Octa findings of retinal microvasculature in anisometropic amblyopic eyes with anisometropic eyes. And our secondary aim was to see the Octa findings and compare the amblyopic eyes with their fellow eyes and anisometropic eyes with their fellow eyes. Our primary objective was to quantify these changes, see the changes in the vascular density in anisometropic amblyopic eyes and anisometropic eyes. And our secondary objective was to compare and see if there is any possible association of these retinal microvascular changes in anisometropia and amblyopia. So we included children aged 5 to 18 years of age who were newly diagnosed with unilateral anisometropic amblyopia, whose fellow eye had a BCVA of 6/6, and for anisometropia, children aged 5 to 18 years with anisometropia of minimum of 1.5 diopters of myopia, hypermetropia and astigmatism, whose fellow eye had 6/6 UCVA. And we excluded children less than 5 years and more than 18 years, and all the eyes which had any organic pathology. We included total of 62 children, 31 in each group, and after consent from the parents and children over 7 years of age, we did the cycloplegic refraction. Then we assessed both anterior segment and posterior segment. Then we did OCT and Octa. We obtained 6x6 and 3x3 slabs. This is the 6x6 slab where we get the fovea and the parafoveal microvasculature. This is 3x3 slab where we get the FAZ region, that is the area, perimeter and the circularity index. And the statistical analysis was done, and p-value less than 0.05 was taken as statistically significant. These are the results. In amblyopic group, the average age was 11.58, and in anisometropic group it was 15.58. Our parameters, the central macular thickness, and in Octa, FAZ in area, FAZ perimeter, circularity index, and the mean vessel density of the superficial plexus in the parafovea. The 4 quadrants, nasal, temporal, superior and inferior, were noted, and we compared that of the amblyopic group to that of anisometropic group. We found that there is no statistically difference between these two groups. This is the bar diagram of the same. Then we compared the amblyopic group with their fellow eye. We found that the mean vessel density of the superficial plexus in the parafoveal region in all the quadrants, in the amblyopic group the vascularity was significantly decreased, and compared to their fellow eyes it was statistically significant. Then we compared the anisometropic group with their fellow eye. We found that the mean vessel density of the superficial plexus was significantly reduced in anisometropic group 2 when it was compared with their fellow eye. This is the bar diagram of the same. There are various studies suggesting that there is decreased macular vascular density and increased FAZ region in the amblyopic eyes when compared to their fellow eyes. But there are no studies currently available that compare the octa changes in the amblyopic eye versus the anisometropic eyes. So we concluded that there were no significant octa changes found between amblyopic group and the anisometropic eyes. And the anisometropic eye, when you compare to their healthy fellow eye, showed decreased superficial vessel density, indicating decreased perfusion in anisometropic eyes. And anisometropic amblyopic eye, when compared to their healthy fellow eyes, also showed decreased superficial vessel density values, indicating a possible association between decreased retinal microcirculation and amblyopia. And the quantitative analysis of retinal microcirculation, octa can be used as a reliable indicator. This study also shows that decreased vascular density is not the only cause for amblyopia, as decreased superficial capillary plexus density was noted in anisometropia too. Hence, the other causes for amblyopia needs to be investigated. These were my references. Thank you.
Thank you, Dr. Priyadarshini. So this was done with the software or manual?
Yes, inbuilt software.
Inbuilt
Yes,
software. So there are some studies which say that the thickness and there is no change also.
Yes, ma'am. There are some studies.
You have not done a comparison with the previous studies, have you?
Ma'am, amblyopia versus anisometropia, this is the pilot study.
Okay. 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 Thank you.
Thank you.